I'm Tara Schwartz, and this is Health Matters. Glaucoma is one of the leading causes of blindness in Canada. Do you know if you're at risk? And what are the warning of glaucoma? Dr. Hady Saheb understands how devastating blindness can be. He is participating in a blindfolded running challenge, all while raising $50,000 to support glaucoma services at the McGill Academic Eye Center. Dr. Saheb is an ophthalmologist in the Department of Surgery at the MUHC and an investigator at the Research Institute of the MUHC. Dr. Saheb, thank you for being with us on the show today.
Thank you, Tara, and thank you for spending some time to highlight this important and exciting project.
It is important and it is exciting, a blindfolded run. So, what inspired you to want to do that?
You know, my very good friend and cousin, Dr. Shireen El-Safadi, had given herself a challenge to run blindfolded and ended up achieving the Guinness Book of World Records for her blindfolded marathon run some time ago. And I was just listening to her journey and was so inspired by her determination and commitment to this cause. And for me, as someone who takes care of patients at risk for going blind, and unfortunately some patients who have gone blind, I felt very drawn to do my part to understand, at least in some way, what it would be like to be without vision. So initially this started as a personal journey and challenge, and then I realized it was also a really good opportunity to raise awareness and inspire others to challenge themselves.
It certainly is. And I mentioned in the introduction that you're committed to running 50 kilometers blindfolded. You have a sighted
hmm
guide when you're running. So what has that experience been like so far? Is it difficult? Is it harder to find your balance? Is it uncomfortable? Tell us a little bit about how you've been experiencing the run so far.
Yeah. Oh my goodness. So I'll try to be positive because that's generally my approach. So I'll focus on what's been positive so far. Overall, I'd say it's been quite transformative. Once the blindfold went on the first time, I really felt the need to focus on what I still had as opposed to what I had lost, which was my sight. And so I realized I was counting on trusting my guide, who I was relying on to keep me safe. I still had my sense of balance, my sense of hearing, smell, and all those were really, really accentuated. And I also felt very focused on maintaining that stamina that was necessary to get through the various runs.
So interesting. So how has it changed your perspective, or has it? How has it changed your perspective running without sight?
100%, 100%. So I can't pretend that this experience actually simulates living with blindness, as
Mm-hmm.
in my case, it's
Yes.
short-lived, of course, and by choice, as opposed to our patients who unfortunately lose this permanently and not by choice. That being said, it is the longest I've gone simulating moving around without sight. And so that connection to some of my patients living without vision was really, really powerful. Sight is just so instrumental to feeling safe and enjoying your surroundings and being independent, and losing it is really frightening.
We are speaking with Dr. Hady Saheb, and we're talking about his blindfolded run to raise money and awareness about glaucoma. So let's step back from the run just for a moment, Dr. Saheb, and let's talk about your specialty. So tell us about glaucoma. What are the warning signs?
So first of all, it's important to know that glaucoma is one of the leading causes of irreversible blindness, both in Canada and worldwide. So it's certainly a very important and unfortunately common condition. And one of the scary things about glaucoma is it's often doesn't have symptoms in the early stages. So really, the only way to detect and diagnose glaucoma at an appropriate early stage is doing regular screening. So seeing a vision care professional every year throughout your adult life to make sure that you don't have any early signs of glaucoma.
And are there some people who are more susceptible to getting glaucoma than others?
Yes. So it's the most common risk factor is age. So that's why after the age of
Mm.
50, it's particularly important. And then other common risk factors are family history. So anybody in their direct family with the diagnosis of glaucoma should be screened even earlier than the age of 50. And then also some ethnic groups, particularly anyone of African descent. So people originally from Africa or Afro-Caribbean or Afro-Canadian populations are more at risk and should be screened earlier than 50 as well.
And if you catch it early, is it curable, treatable? What happens once it's been caught?
thankfully, there's so much that we can do for glaucoma. And so curable is not currently possible, but definitely treatable. We have drops, we have lasers, we have surgeries. And so certainly the key is to have the early diagnosis. And then once that diagnosis is made, an ophthalmologist or a glaucoma specialist can go ahead and give a recommendation for treatment. And in the majority of cases, we're able to halt the disease progression.
We've spoken to eye specialists on the show before, and I never tire of hearing about what it's like for doctors like you who work with eyes, um, and the relationship that you have with your patients in terms of, helping them see. Can you talk a little bit about that?
Yeah, patients come to us with huge levels of stress about losing vision. It reminds us why patients can sometimes be so worried about losing vision. Two, it makes what we do more rewarding if we're taking care of something that's so important to patients. And so, the sight of the sense of sight is so important to the majority of patients that it makes us realize that their concerns about losing vision are valid, of course, and we have to make our best efforts to diagnose their eye conditions and treat them at the earliest stages possible.
And I hear you say that, and at the same time, I'm feeling great compassion and for the people who have lost their vision, that life is wonderful. Like you said, you get to embrace all the other senses that you have when you've lost one. So I certainly don't want to diminish anybody's life who has lost their vision. And I know you share that feeling, Dr. Saheb.
Of course, of course.
Now, I want to get back to your blindfolded run because this is fascinating. So you're running 50 kilometers, but you're running it over the course of these next few weeks, and then your final 5 kilometers will be done on October 7th. So where are you in the 50 kilometers that you have to get, or the 45 kilometers that you have to get to by October?
So I'm halfway through, and I think 150 kilometers is a long way to go in one shot. So
Hmm.
it's been nice to be able to spread it along the 2 months of preparation. And two, it's nice to live this over a period of time so that it's not it's something that I continue to live through and I continue to think about. Essentially every week I'm thinking about this in some way and continue to practice. And it's also giving me this nice build up to the final event where I'm hoping to run with patients and friends to come and support the cause. So I'm about halfway through, and it's become easier with time, as the first time was really, really hard to run blindfolded. And so I am getting used to it, and I'm getting more and more excited about the final go.
Do you think this is something that you'll do more than once? I'm putting you on the spot here. I don't know if it, maybe you're enjoying it enough to want to make it an annual thing. What do you think?
I think that would be great. The challenge, of course, is it requires for somebody to come with me, right? I always need a
Mm.
sighted guide, and so. But I think if I find a volunteer who's willing to run with me at any time, every run is invigorating in some way. Every run is such a nice reminder, a sad but nice reminder of what so many people worldwide are living on a daily basis. And so this has been wonderful for me as an individual and as an ophthalmologist to go through it. So I would love to find a way to continue doing this.
What would you like people who are listening to know about supporting this cause and supporting you? What would you encourage them? How would you encourage them to get involved?
Yeah, I think the first message would be that blindness is absolutely frightening, and it's more common than we think. And glaucoma is one of the leading causes of blindness worldwide. So of course, I want all our listeners, and I want to inspire them to donate. I think that's so important and so needed. But I do have one request for anybody before they click the donate button. I'd love for everybody to just go for a walk, even if it's in the room that you're on your computer, and close your eyes for just 5 seconds. And I think it'll help you realize just how powerful and essential the sense of sight is. I remember the first moments that I put the blindfold on, and it's just you feel your heart rate going up and your heart racing, and it's so frightening to lose that sense of sight. So I do encourage everybody to at least feel that for a few seconds, and I'm sure that anybody who goes through that will recognize how frightening it is to lose your sight. And finally, for all of you who have supported this cause so far and will support it moving forward. I'm so grateful. You're helping raise awareness. You're helping being our cheerleaders, and of course, donating and helping the MUHC continue and improve their world-class care. So thank you so much.
I really, really love what you said, Dr. Saheb, and I promise to do that today after the show is over because I want to feel that. I want to feel that sensation to remind myself and to, to think about what you're doing. So I do thank you for that, and I thank you for coming on the show and talking about this and for doing this blindfolded run because it really is a wonderful thing that you're doing. So thank you so much.
Thank you, Tara. Thank you to everybody listening.
And if you want to support Dr. Hady Saheb on his run, it is taking place on October 7th. You can head to the MUHCfoundation.com website. You'll find his photo, his story, his fundraising page, so you can read all about it and you can donate to his